Welcome to this episode of Vote Like a Texan. Today we're sitting in House District 47, and we're with candidate Jennifer Mushtaler, who is running for House District 47 as a Republican. And in a unique situation for these House District races, you don't have a primary contestant. So we are here for the long haul all the way through the general election, and you're running on the Republican ticket for House District 47.
Thanks for having me, Justin. Yes, I am. I'm an OB-GYN by background, so I say I've got a pregnancy ahead of me till we get to November.
You know, you're probably one of the few that would think about it that way, but it is that kind of circuit.
A timeline.
You've got the 3 trimesters that you work through, and it's really different in the beginning as you're getting started to that last push. So you would know better than I, but it sounds like a good frame of reference for the year to come.
Yeah, we're excited. We're excited.
Well, tell me, what has you interested in running, and what made you decide to run? It's a big obligation just to campaign for a role like this.
It is. I have become civically engaged. My area, my neighborhood was annexed by the city of Austin back in the mid-teen years, and in that transition we formed what's called a limited district. So we retained some autonomy for our area, and when that happened I was asked to serve as the limited district president for about 1,200 households. So we have a taxing authority, we have an ad valorem taxing district that was utilized to run common services including solid waste for the area, security for the area. We have a lot of parks and green spaces. This district has a lot of preserve, Balcones Preserve, and wildlands. And so I served as the limited district president, and in that transition that brought me into engagement with the city and city politics. I've subsequently served 2 terms on the City of Austin's Planning Commission as appointed by the council members and the mayor. And I was actually working on a city council campaign when somebody said to me, you know, we need people like you to serve an elected office. And conversation, that's fine. But some of that conversation was around some of the medical things that have been taking place, particularly in the OB-GYN space in the state of Texas. And it got me thinking. It's been a missing voice in the room. It's been a missing voice in the ledge. There is not, there's fewer than 5 physicians in the ledge, and there certainly is not an OB-GYN there. And so when the seat was vacated and I was asked to run, I thought, you know what? I have the bandwidth. I have the desire. I've been serving in my community anyway. Let's do this. Let's take this to the State House.
I applaud the commitment and the drive, because it is important that we have expertise in the ledge to ensure that when these issues are talked about, there is a frame of expertise that can help guide other legislators to understand, ask questions, be informed. I see it similar in oil and gas in Texas with very few engineers in the state legislature. And I see that as a myth.
I'll give you a 2-for-1 on that, Justin, because my background is engineering. I took kind of a circuitous route to medicine, so it's a 2-for-1 on that.
Well, I always welcome engineers into the conversation. They ask a different level of question, and they get to a different level of understanding just by academic training, similar to a physician, I assume. So it's great. It's great to have that thoughtful leadership in the room that has a background and expertise. And I get in trouble for saying doctors and lawyers and such, but it is a little bit of, we've got to have everybody in that room, because you're seeing issues across the state and across human density that you see a little bit of everything.
There's a lot to follow up and touch on that. But we tend to think about things in terms of systems and infrastructure and stability and stepwise, how you step through, diagnose problems, evaluate them, and then come up with either an engineered solution or a medical treatment plan, that kind of thing. So Very analytical, very pragmatic.
As you've campaigned across your district, what are you hearing from the people? What is their concern in this election cycle?
And I am choosing to focus on the HD 47 issues. We hear a lot about the federal narrative, the federal talk. But at the district level, the concerns are property taxes, and as a component of that, property insurance and affordability. That is a big issue for my district and a number of neighborhoods in my district that I had been working on previously. Public education is a huge one for our district. This district is kind of interesting. We've actually got 7 independent school districts that all cross through HD 47. And amongst those 7, we're paying $900 million plus back to the general fund under the current recapture plan. Some of our districts are doing really well, and some of our districts are really struggling. So that is a huge issue in our area and top of mind. And then healthcare affordability, that is another big one. And if you look at the state budget, 40% of our state budget is going towards healthcare. I don't think people realize how much of that is going for state healthcare and those programs, and 30% of our state budget is going for public education. So I would say my constituents, my neighbors, my voters are correct. These are top issues, not only for our district, but also for our state.
Well, help me understand that, because that's a huge percentage going to both of those buckets. And education, I can see because we see the school buses on the road, we know the number of kids, et cetera. But on the healthcare side, where is that money going? Is it for programming? Is it for individuals? What does that look like?
Well, at the state level, it's a large wash of programs. So a big portion of it is going to our healthcare safety nets. So Medicaid programs are administered by the state. There's a lot of discussion about whether the state of Texas should have accepted federal funds to expand Medicaid or not to expand Medicaid. We already have a large portion of the state budget going there, and that is part of those programs. Within that, there are other funding and allocations that comprise up the healthcare dollars as well. Texas has fantastic medical care in our urban centers. We've got national and international leaders of excellence and innovation, including here in the Austin area. And then we have completely opposite, we have these vast healthcare deserts across our state where access is a big issue, and insurability and insurance access is a big issue as well.
I was recently talking to the mayor of Alpine, Texas, and she shared that their ground ambulance contract had expired and the company wouldn't renew it. And it made me really think about what those rural healthcare solutions can look like. And when you're that far out and you don't have an ambulance, what does that mean? So it is a topic of conversation across the state, and a voice like yours would probably be welcomed in how do we think about these bigger issues, not at the individual patient level, but at the systems, because it does start with the home and then the infrastructure for services.
Yeah, I think it's an every person issue, because it's not just the systems and the access, but the costs and the direction of the cost of healthcare right now is unsustainable. We're seeing that. It doesn't matter which side of the argument you're on or what your perspective is. Everybody understands if they're on a plan that their premiums are going up, their coverage looks less. And if you're an employer, you understand that your employer-sponsored part of the premiums are going up and people are getting less. So it's everything from the access to the affordability to what that does to individual households, and what it does to our businesses.
Now, with your experience in leadership, and let's call it public service, you've gone through the learning curve of statute, ethics, things that an elected official can do and things that they can't, because I hear it often that, well, I'm going to go talk to the House of Representatives. They're going to be able to shake this tree. Sometimes they can't. It really depends on what the issue is and how to approach it. And I appreciate people that run for office that have already gone through the volunteer roles of planning and zoning, or really learning how that statute role works. And it seems that you have a good understanding of that, because the budgets get big very quickly. It gets hard very quickly if you haven't experienced it before.
That's true. That's true. And I think I would be bringing a really pertinent perspective as it pertains to healthcare, because I've been on both as a physician and I've had my own business. So over 10 years in the district, I was a small business owner. I understand what property taxes look like on a small business. I understand what it means to meet payroll. There's just a big difference when you're an EIN instead of a W-2, and you've got employees that you're responsible for and their families are relying on you. So that's a whole different perspective. But I've also spent a few years now on the insurance side, and that's been a very interesting optic. And people ask me, what can we do at the state level? And there's ways in which plans are constructed. So as a House rep, at the state level, right, I'm not going to have jurisdiction over what's happening at the federal level, but there are plans that are crafted within a state. There are fully insured plans within a state, and there are certainly things that we can do. And this is where I kind of see it as an advantage. While some people were upset that we didn't expand Medicaid, the fact that we kept it contained within Texas, and that's our own internal funding mechanism, means we also have a tremendous amount of oversight in how we choose to have those programs administered and how we choose to allocate our funds. So I think that'll be a nice area of expertise to bring to it. And yeah, having served now 2 terms on the City of Austin's Planning Commission, I do understand the property issues, the zoning issues, things like that. Again, this district is interesting because it's not all City of Austin. I've actually got City of Bee Cave. I've got City of Lakeway in there. So I've got other cities in this district, and I've got county and municipal. And what each of their jurisdictions and authorities are also varies under the law as well.
And for the House of Representatives, help me understand the role, because when you think about Lakeway, Austin, and some of these infrastructure conversations, that falls more to the local level. But I think there is a role for House of Representatives in some of that planning, but I'm not sure what that looks like.
Advocating. So, right, we've got an area regional transportation group called CAPCOG here that is a partnership between cities and counties, and looking at what dollars do we have and what the priorities need to be for, and in this case, we're talking transportation infrastructure, but a lot of that can be coordinated with TxDOT, which is at the state level. And some of our roads are state, have our oversight by the state. Some of them are city, some of them are county. So there really is a coordinated dialogue that needs to take place to identify which projects need to be worked on and to identify where the dollars need to go. Right now, the state is spending a lot of money on the I-35 corridor, which runs through central Austin, which is, and it's interstate, right? So it's not just Texas. This is connecting Texas to its neighbors, and that's a very important corridor. But the fastest rate of growths are actually in my district, at the northwest side of 47 and at the southwest side of 47. And I know, for example, there's some very significant transportation and infrastructure issues that are happening through Bee Cave and along our 620 corridor. CAPCOG had to push off some of the projects that were supposed to happen along the 620 corridor. So as a state rep, I want to bring those entities together to coordinate to make sure we're getting dollars into my district that should be allocated that direction.
It does take that oversight and that advocacy to really ensure that that project is aligned, because at that point you're competing resources for work in Houston, work in Dallas, always in San Antonio.
Right.
And it just seems like TxDOT is doing a lot, but that is because of the growth that we've seen, particularly post-COVID. The Austin area, your area of the city, has really exploded in population growth, and that brings unique challenges.
It does. Anything from the shifts in the demographics and where the population is going for schools and school enrollment, what that looks like, to how the roads are holding up and infrastructure. And then when we go infrastructure, of course, power, water utilization, and public safety, and all of those services that need to be. And those are, you and I were talking about what's the role of a House representative. When it comes to some of those things, they're going to be allocated to the municipalities and the cities. But these are very important for a growing district like ours.
And I liked your summary around advocacy, because it is something that several different elected officials work on and someone owns differently, but they need the state level advocate that can help them really open doors and move the conversation forward.
And part of the concern was, so the previous representative who occupied the seat, a number of people felt like our district didn't really have a strong voice at the House, and particularly when folks are unhappy with things that are going on in the city or that kind of thing, there was no way to escalate that conversation or get eyes and solutions on those or partnerships on those. So that's something that I would want to change.
I could see that being welcomed by your constituents, but where can they learn more about you? Where can voters learn more about you, your plan, your advocacy, and get involved with you? Because I'll put it out there for you to say volunteers are always welcome. This is a team sport for sure.
Yes.
And so as you go through the next 9 months, there is a need for supporters to come out and partner with you. So
I am on Instagram at Dr. Jen for Texas. We also have a web page. I'm on www.drjenfor Texas. So Dr. Jen for Texas. And we'll be growing and expanding from there.
Well, fantastic. I look forward to watching your race. It's going to be an interesting one, just based on geographically where it is and how many voters you have. And I'll remind the voters to say, you don't have a primary contestant, but they should be looking at March 3rd and making sure they vote in the primaries where it matters to them, because there are a lot of races out there doing that.
And I always try and encourage people to get out in these primaries, to get out in your local races. A lot of what happens and develops and works its way up to the federal level starts here in these smaller races and these smaller elections. So absolutely, please read up on your candidates and get out the vote.
And then we'll be excited to see you in the general election and ensuring that people are getting out to vote, they're getting involved, and they come to your events and get to know you personally. So, Jennifer Mushtaler, thank you for the time, and thank you for campaigning and running. That is a commitment on its own.
Thank you very much for having me, and we'll see you as the fall approaches.